Hi, I'm Norm Bonner, Clinical Trainer for Concentra Medical Centers. Today's video will cover OSHA's respiratory protection guidelines and respiratory fit testing using the qualitative fit test method. Prior to performing a fit test, the subject must receive medical clearance from a physician or licensed healthcare professional. I will refer to this person as the PLHCP going forward. The PLHCP must review OSHA's respirator questionnaire or perform a respirator physical exam. All persons must answer questions 1 through 9 on the questionnaire. If the person is wearing a full face mask or a self-contained breathing apparatus, they must continue to answer questions 10 through 15 as well. Part B is discretionary, but we would advise the donor to fill out this section as well. In conjunction with the questionnaire or physical examination, the PLHCP must also review the employer authorization and information for respiratory use document. This is a generated OcuSource document and it contains additional information on the use of the mask. OSHA's regulations mandate that the employer supply additional information to the PLHCP. This includes the type of mask to be worn, for instance a full face mask, a half face mask with canisters, a dust mask, or even the N95 mask that may be used in the pandemic flu environment. It would also include the weight of the mask, how long the mask would be worn, any additional work effort that the person may be required to perform while wearing the respirator, any protective clothing that would be worn while wearing the mask, and other information. With this additional information and the questionnaire, a determination can be made as to whether or not the person is medically qualified to wear this mask or possibly have certain work restrictions on its use. If you do not have this supplemental information, you must contact the company. Please request the information from the employer, fax them a blank copy, ask them to keep this blank copy on hand, and they can fill out these copies for individual employees that they are sending down to the clinic for the respiratory fit test. Do not keep any pre-filled out forms on hand because there may be some changes at the company's respiratory protection program, and these forms need to reflect those changes. The PLHCP written statement of opinion is what determines whether the person is medically qualified to wear the mask. You must ensure that the PLHCP has documented their determination on this form called the written statement of opinion. Once documented, the fit test can proceed. There are various reasons to wear a respirator. A few examples would be a subject working with smoke, dust, organic vapors, formaldehyde, or even asbestos. If the respirator is not sealing or fitting properly, the potential for illness greatly increases. Some chemicals are immediately dangerous to life and health if they are inhaled. Others may take some time to affect that person. Your job is to ensure the fit and seal of that mask. Stress the importance of a good seal to the subject. Advise them of the consequences of a poor seal. They may not develop any problems immediately, but down the road they may develop some serious lung issues. This video will be covering OSHA's regulations on fit test procedures using the qualitative fit test method. There is another method that is approved called the quantitative fit test method. This type of method would require a port-account instrument that actually adapts this mask to hook up to an instrument. It checks the particles inside the mask as well as the particles outside the mask. Prior to performing this fit test method, you would still need the PLHCP, or physician or licensed healthcare professional's written statement of opinion determining whether this person is medically qualified to wear the mask. There are 4 types of approved OSHA respiratory fit testing methods. They are Bitrix, saccharin, irritant smoke, and banana oil. The equipment that will be used for fit testing will include a tent or a hood, 2 different types of nebulizers, one for the sensitivity test and one for the fit test itself. When preparing the solution, pour 1 teaspoon of the sensitivity solution into the nebulizer, or if you're using a pre-filled ampule, empty the contents into the sensitivity nebulizer. Pour the same amount of fit test solution into the second nebulizer that will be used for the fit test itself. There shall be no hair growth that comes between the skin and the facepiece sealing surface. OSHA Fit Test Regulations 1910-134, Appendix A, state that the test shall not be conducted if there is any hair growth between the skin and the sealing surface of the facepiece. This would include stubble beard growth, beard or mustache, or sideburns that cross the respirator sealing surface. Goatees generally do cross the sealing surface and therefore must be shaved prior to the fit test. Soul patches, which is a small amount of hair underneath the lip, generally do not cross the sealing surface and are acceptable. Sensitivity testing is performed to see if the subject can taste the solution that will be used. The solutions that are going to be used in this case are Bittrex, saccharin, or banana oil. If you are using irritant smoke, you have to determine whether or not the person responds to the irritant smoke, again, prior to the actual fit test. When doing the sensitivity test, the subject is placed underneath a hood or a tent without the respirator. Their mouth should be slightly opened and their tongue slightly extended. Inject the sensitivity solution into the tent or hood away from the donor's face until they can taste the solution, or up until 10 times. If the subject tastes the sensitivity solution anywhere between 1 and 10 squeezes, you count this as 10 squeezes when actually performing the fit test with the respirator. If they detect the taste between 11 and 20 squeezes, you count this as 20 squeezes when performing the actual fit test with the mask. If they taste the solution between 21 and 30 squeezes, you count this as 30 squeezes when actually performing the fit test. If after 30 squeezes the individual cannot taste the Bittrex or saccharin, you would have to use an alternate method. An example would be if I'm using saccharin as a sensitivity solution and they cannot detect that smell, I would have to use Bittrex. If I'm using Bittrex on the sensitivity and they can't detect